Welcome back everyone. This is a continuation video of the series of excretory system. Okay, so today we are going to continue with this counter current system. It is a system that resides inside our nephron in case of all the mammals to produce a very concentrated urine. Okay, so what is particularly this counter current system? This counter current system is a system of U-shaped, look, it is a U-shaped tubes in which the flow of fluid is in opposite direction in the two limbs of the U tube. Okay, so you can see that in this particular diagram, in this is the descending limb and this is the ascending limb of Henle. So in this descending limb, the fluid is going down in the below direction or towards the gravity, you can say. But in this ascending limb, the fluid is going against the gravity. So these are two different directions. So why is it important? Let's go. Mammals have the ability to produce a concentrated urine. Absolutely. The Henle's loop and vasa recta play a significant role in this. So what is vasa recta? That blood capillary, the capillary system that runs parallel with the nephron. So here you can see this is the vasa recta and this is our nephron. Okay. The flow of filtrate in the two limbs of Henle's loop is in opposite direction and thus forms a counter current. I have already told. The flow of blood through the two limbs of vasa recta is also in counter current pattern, which help in maintaining and increasing osmolarity towards the inner medullary interstitium from 300 milliosmol per liter in the cortex to about 1200 milliosmol per liter in the inner medulla. So what is that? Here you can see that this is the Malpighian portion. No, this is the early portion of the PCT and these are the DCTs. So the whole of this Henle's loop, it remains in the medulla and this portion remains in the cortex. So what happened? You can see here. Let me mark it for you. Look, in this portion it is 300, or you can also see here in the cortex the osmolarity is 300, but when it is going down the tube, you can see at the far end of the Henle's loop it has reached to a portion of 1200. So it means that the osmolarity it increases. In simple term, you can see that it is losing solute and the amount of solvent it is increasing, isn't it? The moment the amount of solvent is solute is increasing, that means that its osmolarity will also increase. Okay, the gradient is mainly caused by NaCl and urea. So what are the solutes? That sodium chloride and urea, this remains in this solution, means that is a primary urine, we can say. NaCl is transported by the ascending lip of Henle's loop, which is exchanged with the descending lip of vasa recta. Let me tell you one thing. You can see in this particular this descending limb that water can be taken out from this limb. No, means water can remove from this limb. It is permeable to water. But look, the ascending lip of Henle, it won't release any amount of water, means it is impermeable to water. You can also see in this diagram the ascending lip of Henle, it is releasing sodium chloride, but no water is there. Now, so what happened? What is the counter current? Look, there is a continuous exchange from this nephron of water to this vasa recta. These blood capillaries are there. They absorb almost all the amount of water, maximum amount of water from this urine, and they produce a concentrated urine. And also in this is our collecting duct. So they always absorbs water, urea, all these things. Okay. So the end result is that when the urine is going to remove from this nephron, it should be removed in the maximum concentrated proportion. So that is the basic idea. Okay. So NaCl is transported by the ascending leaf of Henle's loop, which is exchanged with the descending leaf of vasa recta. Look, the ascending leaf of Henle, it is releasing sodium chloride, and this sodium chloride is again is being received by this vasa recta or this blood vessels that remains. No. Then the NaCl return to the interstitium by the ascending portion of the vasa recta. Small amount of urea enter the thin segment of ascending limb of Henle's loop, which is transported back to the interstitium by the collecting tubule. Presence of such gradient helps in an easy passage of water from collecting tubule, thereby concentrating the filtrate. So this is the countercurrent system. It is the two U-like structure, this Henle's loop, this descending and ascending loop, and continuously the water and sodium and the ions are being exchanged with the vasa recta, and hence producing a concentrated urine. Okay, as they run into opposite direction, hence they are known as countercurrent system. Okay, so now regulation of urine formation. Look, the urine formation, it depends on some factors. Okay, there are three hormonal feedback mechanisms that control the function of kidney, hence regulate the urine formation. So what are those three? Let's go through it. Control by ADH, controlled by juxtaglomerular apparatus or JGA, and renin angiotensin aldosterone system, controlled by atrial natriuretic factor. Okay, atrial natriuretic factor. So these three we are going to discuss. So let's go through it. Controlled by ADH. We know ADH, the anti-diuretic hormone. The other name of ADH is vasopressin. Okay, let me write it for you. Vasopressin. So what happened? There is a very beautiful diagram you can see. It's not a diagram actually, but though. Look, the stimulus. What is the stimulus? You know, hormones, they always excreted, or they not excreted, sorry, they secreted when there is a particular stimulus, isn't it? The release of ADH is triggered when osmoreceptor cells in the hypothalamus detect an increase in the osmolarity of the blood. So one question can come in your mind, that what is osmoreceptor? Look, receptors are there inside our body which helps us to grab the stimulus from the environment or the bodily changes that happen inside our body. No. So like there are some baroreceptors. Suppose someone presses your skin, or your skin got some scratches through some or some injury happened. So your body can feel it. You can feel it. So these things help by the baroreceptors, which gives you that pressure sensitivity. There are thermoreceptors, which gives you the heat sensitivity. Suppose you put your finger to the fire and it will start burning out. So those are the types of receptors. So like that, there are osmoreceptors which can sense the change in osmolarity, or you can say the osmotic pressure. Okay, so what happens when there is a change in the detect an increase in the osmolarity in the blood, means the blood gets concentrated. So the moment your blood gets concentrated, you can understand that your blood pressure will also increase. No. So when the blood pressure increases, it gives a stimulus to the hypothalamus, that supreme commander, in our brain. And this hypothalamus stimulates the ADH inside, stimulates the posterior pituitary to secrete ADH, or also known as vasopressin. So what ADH has done, it has increased the permeability of the distal convoluted tubule and collecting duct. What is that? Means ADH will help the collecting duct and distal tubule to reabsorb more water, which in case then increases the water volume in the blood. And also this hypothalamus, it stimulates the thrust mechanism. Means when your body have less amount of water, at that time you feel much more thirst. So these things all done by our hypothalamus. So thrust mechanism also gets kicked on, and it and we drink water. Drinking reduces blood osmolarity to a set point. Means it's being taken back to a normal condition, to homeostasis or blood osmolarity. So let me tell you one short thing. What is homeostasis? Homeostasis means staying in a balanced way. So when everything is normal, the water content in your blood, the ions content in your blood, they are normal. So it's being said that you are in homeostasis. When you are not in normal, then all these processes they kickstart. Okay, so here is another one. So increase in blood osmolarity or decrease in blood volume. Yes, osmolarity means blood volume decreases because the water in the blood is less. That's why osmolarity is more. Okay, volume affects neuron in the hypothalamus, resulting in the increase of ADH release. So ADH release from posterior that hypothalamus. It stimulates the posterior pituitary, releases ADH secretion. ADH increases water reabsorption in the kidney, resulting in retention of greater volume of water in the blood, a reduced urine volume and decreased blood osmolarity. There is also an increase in blood volume. Okay, and when this happens, when there is no need of ADH, a decrease in blood osmolarity or an increase in blood volume affects neuron in the hypothalamus, resulting in decrease in ADH released from the posterior pituitary. So when this reduced ADH, so ADH secretion, so reduced ADH decreases water reabsorption in the kidney. So when less ADH is there, it will not be able to reabsorb the water from the collecting duct as well as from that our distal convoluted tubule. As a result, it will produce a very dilute urine, or you can say that urine that have much more water volume. As a result, it is a condition which is known as diabetes insipidus. Okay, diabetes insipidus. So let me just write it for you. I'm just writing it as DI. Okay, diabetes insipidus. When happen? When that ADH secretion is very less. Okay, as a result, we do excrete a greater volume of urine. Okay, it's not concentrated, but it's very diluted one. So that is the mechanism how ADH hormone works. Okay. Now here is a quick chart I have made for you. Water deprivation. Okay, the question is how water intake can impact urine formation. Water deprivation means when you are without water. What happens? Plasma osmolarity increases. That in case stimulates osmoreceptors in the anterior hypothalamus. The moment anterior hypothalamus gets stimulated, it increases the release of ADH from the posterior pituitary, and in later case the water permeability of the late distal tubule and collecting duct is also increases. As a result, water reabsorption increases, urine osmolarity increases, and urine volume get decreases. Okay, but what happens when you are taking water, enough amount of water, plasma osmolarity decreases, inhibits osmoreceptors in the anterior hypothalamus. As a result, the ADH secretion from the posterior pituitary decreases. Water permeability of distal tubule and collecting duct is also decreases. Water reabsorption decreases, urine osmolarity decreases. What is that? Urine osmolarity, I have already told you, means there is much more solvent than solute. Hence, the osmolarity decreases and urine volume increases. In this case, in this portion, as ADH secretion from the pituitary decreases, if in a diseased condition this thing continue keeps on going for a longer time, it can cause diabetes insipidus. Okay. So if you are taking enough amount of water, your urine will be just the same like the normal urine. If you are taking less amount of water, in that case your urine volume will get decreased and you will have a much more concentrated urine. Okay, now comes the control by JGA and RAAS. Very important thing and very interesting one. Okay, so let's go through it. When body loses sodium ions, it loses water by osmosis, resulting in a low blood pressure and low blood volume. Okay, this is detected by the baroreceptors. Look what I have told, the some receptors which can also sense the change in the pressure. No, so baroreceptors, they can understand, they can check whether there is any change in the blood pressures. So the low blood volume or low blood pressure is being detected by the baroreceptors present in the carotid sinuses. What is it? Carotid sinuses. It is in the upper portion of our body, especially around the neck regions. Okay, and the JGA, juxtaglomerular apparatus. This is the most important thing. The JGA is located at the vascular pole of the glomerulus, where a portion of the distal convoluted tubule comes into contact with its parent glomerulus situated near the Bowman's capsule. Here you can see a very nice little diagram. Look, this is the afferent arteriole, and this portion comes in contact with the distal convoluted tubule. So these particular cells, they are the JGA or juxtaglomerular apparatus. JGA secretes renin. So why this JGA or this juxtaglomerular apparatus, it's so important because it secretes an important hormone named as renin that kickstart the RAAS pathway to bring the blood pressure in balance. So is a quick thing. You can see stimulus. The juxtaglomerular apparatus responds to low blood volume or blood pressure, such as due to dehydration or loss of blood. Okay. So what happened? This JGA, they secretes renin. Very easy things. No, these charts. They secretes renin. Renin acts on angiotensinogen that released from the lungs, and they turns it into angiotensin. What angiotensin 2 does, it stimulates the anterior gland to secrete. Oh, as it is a excretory system, so every time I'm just spelling out excrete, sorry. It secretes aldosterone and also stimulate the arterial constriction, means the blood vessels, they get constricted. As aldosterone is being released, what it does, it increases the sodium and H2O water reabsorption in the distal tubules, and as your blood vessels are being getting constricted, so as a result blood pressure and blood volume increases. Okay, let's go in a deeper study about it. So these are RAAS. Look, drop in blood pressure. Okay, drop in blood pressure. So the moment your blood pressure is getting dropped, or suppose you have made an accident, so what will happen, you will lose much more amount of blood. So your kidney will get stimulated, it will secrete renin, the enzyme renin. What this renin does, from the liver it releases angiotensinogen. Okay, sorry, in the earlier chart I have just mentioned angiotensinogen released from lungs, but actually is released from liver. Then this angiotensinogen is getting activated into angiotensin 1 by renin. So renin is an enzyme which activates angiotensinogen. Okay, as the moment angiotensin 1 is getting activated, in later case it's also get converted into angiotensin 2. Look, the size of this hormone, it's also getting decreased. This is 10 amino acid long, now it become 8 amino acids long. So the more less in the structure, so it can be much more proactive to do its work. So how this angiotensin 2 is being getting activated? The lungs, our lungs, it release a enzyme called as ACE or angiotensin converting enzyme. So this ACE, it's stimulate the angiotensin 1 to form angiotensin 2. What it does, this do three function. It tells the hypothalamus, it stimulate the thrust sensors and increase your thrust, and as a result you drink water, you try to drink water. It also does vasoconstriction. What is this? Very easy things. Simply it helps to constrict the blood vessels and tells the adrenal cortex to release aldosterone. Aldosterone, what it does, in the DCT or distal convoluted tubule, it increases the salt and water retention. As a result, elevated blood pressure. Very easy. So that is a RAAS. Renin is the enzyme that's activating angiotensinogen, and ACE also, it comes from the lungs, it activates angiotensin 2. As a result, these three things happen. It releases aldosterone, it helps in vasoconstriction, and it stimulates the thrust sensor inside our hypothalamus to let us drink much more water. So that's why RAAS, renin, angiotensin, aldosterone system. Okay, renin is the enzyme, angiotensin and aldosterone are the two hormones. I hope it will help you. Let's go to NF, atrial natriuretic factor. This is a particular hormone which released from the wall of the atria of the heart, opposes the regulation of RAAS. Actually, what happens in RAAS? It helps to increase the blood pressure. So, if every time the blood pressure is in the increased condition, so it can also be harmful for our body. So, for that, there is an opposite mechanism that also protects us. Okay, that is ANF. Increased blood volume and blood pressure by RAAS. It stimulates the release of ANF from the atrial wall of the heart. As a result, when this ANF is released from the atrial wall of the heart, it inhibits the release of renin from the JGA. It inhibits this JGA to stop the renin production. Okay, reduces the release of aldosterone from the adrenal gland. So look, very important two things it has already done. It inhibits the release of JGA. It also reduces the release of aldosterone from the adrenal gland. So as a result, what happened? Less absorption of NaCl and DCT and the collecting duct. Okay, what RAS has done, it has secreted aldosterone. As a result, the DCT reabsorbs much more salt and water to the blood, and it also increases that the pressure of the blood and the amount of blood. But what ANF has done, it has stopped the renin, so it is stopping the RAS in the earlier stages, and also it stops the aldosterone to release from the adrenal gland. So there will be no one to reabsorb the NaCl and water from the distal columnar tubule. So as a result, decreased blood pressure and blood volume. Okay. One more thing, role of erythropoietin. It is a very small but yet important thing in this chapter. Erythropoietin or EPO released by the interstitial cells of PCT is essential for the survival, proliferation and differentiation of erythrocyte progenitors in the bone marrow. So let me just show you. Oh, I've just sorry, the diagram is not there. That EPO is released from the proximal columnar tubule. Interstitial cells means these are they are the PCT cells. PCT means it's a tube-like structure, and the cells remaining in between the cells of the proximal convoluted tubule. From there, erythropoietin is released, which is very important for the production of RBC or erythrocyte. Okay, what it does, it is essential for the survival, proliferation and differentiation of erythrocytes progenitors, means the early cells from which the erythrocytes born in the bone marrow. Okay, erythrocyte production is continuously adjusted to regulate the loss of senescent red blood cells, means the and to guarantee optimal tissue oxygenation. Okay, so what is that? This erythropoietin, it is it is the main hormone which helps the erythrocyte to grow, and it helps the erythrocyte or RBC to use to carry as much of tissue or as much of oxygen as possible. Okay, the recombinant EPU is very effective in treating the diminished erythrocyte production that accompanies end stage kidney disease. So recombinant EPO means this erythropoietin is being genetically made in the other organisms, so it can be injected or administered inside a human body in a diseased condition. Okay, so it is a very effective in treating the diminished erythrocyte production that accompanies end stage kidney diseases. So these are the function of EPO. Tissue protection, it stops apoptosis, means it stops cell death. Okay, it enhancement of immune response. EPO also helps in immune response. Induction of angiogenesis is it helps in the growing of new blood vessels. Suppose any wounds happen, so involves in wound healing cascade. It helps the wounds to diminish quickly. Okay, and anti-inflammatory effects. So these are the functions of EPO. You just need to remember very few of them and the name and what is their function. Okay. The definitions are there. GFR is a hot topic of this excretory system. The amount of filtrate found in all the renal capsules of both kidneys per minute is called glomerular filtrate rate or GFR. GFR in a healthy individual is approximately 125 ml per minute. So what is that? 180 liter per day. So in both the kidneys, in a one day we generally supposed to excrete 180 liter of water, and we have how much amount of blood? Just 5 liter. So you can think that why that counter current and that reabsorption, those hormonal function of ADH, then what that aldosterone, RAAS systems, why they are so important. So means almost everything is being taken back to your body, and just 1 to 1.5 amount of liter of urine we excrete in one day. Okay, vasa recta, the blood capillaries surrounds the renal tubules, descend into the medulla in parallel with the loop of Henle, and then loop back along with the loop of Henle to the cortex. Micturition refers to the process of filling of urine in the urinary bladder and the process of release of urination. In the books of yours, is it mentioned that micturition is just the process of release of urine, but no, actually the process through which that our urinary bladder is getting filled with urine, and later case the whole nervous system, that stimulation through which we do excrete our urine, that urination, this whole process is known as micturition. Only the definition has been asked, so that's why here it is. Homeostasis, one term is there, you need to know about it. The kidneys remove waste products generated by metabolism such as urea, uric acid and creatinine by producing and secreting urine. So through urine our body excretes these things. No. Urine may also contain sulfate and phenol waste and excess sodium, potassium, chloride ions, everything. The kidney help maintain homeostasis by regulating concentration and volume of body fluids. So simply, the homeostasis I have already told is maintaining a stable conditions. So if there is excess of excrete waste products inside our body, it needs to be taken out to maintain that stable condition. If more water is there, so it also need to be taken out. If more ions is also there, so the same cases. So the main thing is that kidney helps us to contain a homeostasis or a stable condition. Okay. Now the disorders of kidneys, uremia, a condition when the level of urea and other nitrogenous waste in the blood increases due to malfunctioning of the kidney. So what is the cause? Malfunctioning of the kidney is called uremia. The artificial removal of waste by hemodialysis is a must, otherwise the patient dies due to a kidney failure. Renal failure or kidney failure. In renal failure, kidneys cannot carry out renal functions partially or totally by bacterial infection. So you need to remember the causes. Okay, bacterial infection, bacterial toxins means the products that released by the bacteria when they infect our body. High blood pressure, look, very critical thing. Obstruction of artery or veins, internal deposition of calcium and hemorrhage. Hemorrhage means internal bleeding. So all this causes renal failure. What are the results? Uremia, okay, means the nitrogenous waste cannot be removed from the body automatically. Imbalances of salt and water in the body, absolutely. Retention of water in the body because the kidney is not doing its work. So your the water that you are taking, it is not going through out of the body. So it remain inside the body. And stoppage of erythropoetin secretion. So these are the results of renal failure. Okay, renal stones or renal calculi, stone-like structure found by the accumulation of oxalate crystals. I'm just marking it. Okay, very important thing. Oxalate crystal that may block the kidney tubules. On passing down into the ureter, this cause blockage of ureter and severe pain in the back that spread down to the thighs. Depending on the size, kidney stones are crushed by lithotripsy or removed surgically. Okay. Nephritis, there are two types of nephritis. Glomerulonephritis, actually it is the inflammation of the different renal parts. In the inflammation of glomeruli caused by drug reaction or by bacterial toxin. Due to improper filtration, proteins and RBCs pass out in the urine. Look, so what happened? No, that it is just hampering that mechanism of that filtration. So from the blood some the proteins, that plasma proteins and RBC also passes out through the very painful situation. And this is pyelonephritis. It is inflammation of renal pelvis calyx that is caused by bacterial infection. It has a profound effect on countercurrent mechanism. So countercurrent mechanism is being hampered. Symptoms are pain in the back and frequent urination with pain. Okay. So glomerulonephritis and pyelonephritis. Hemodialysis is an artificial kidney. It is our life savior. I've just made a definition. You can go through it. Dialysis is a process by which micromolecules are separated from macromolecules by the selective diffusion through a membrane. So there is a membrane. It is just like our kidney, just like our nephrons. Okay, macromolecules are being the macromolecules are being separated from the macromolecules. By this process, the urea is removed. By this process, the urea is removed from the blood of urinic patient. The apparatus used for this purpose is called as dialyzer. Okay, artificial kidney or this hemodialyzer is used to filter the blood of a person whose kidney are damaged. The process of purifying blood by means of artificial kidney or hemodialyzer is called hemodialysis. Okay, so this is the diagram. So look from here, line artery to vein pump. There is a needle has been put inside the artery. The blood is coming through it. It's going to this hemodialyzer. These are the membranes through which the uh, that blood is being refined, and these are the used dialyzing solution with urea and excess salts. These are the salts that are there. You need a dialyzing solution which just helps to excrete that excrete material from the blood, and the fresh blood is being returned to the body again. So these are very what should I say, is a very priceful things mechanism, and which is a life savior also. Okay, so hemodialysis, or that is your artificial kidney. So I hope it will help you, and if you like or if you want to know about more things, do mention me in the comment box. Thanks. See you soon. Take care.